Hello, this is Dr. Majid. I am internal medicine resident at Advent Health, Sebring, Florida. The title of my abstract is Cardiovascular Outcomes of Xanthine Oxidase Inhibitors versus Placebo, a meta-analysis. Let's get started. Hyperuricemia is a recognized risk factor for cardiovascular diseases. However, mixed results have been reported regarding whether uric acid lowering xanthine oxidase inhibitors, commonly prescribed for gout, are associated with reduction in cardiovascular events and death. This meta-analysis aimed to compare the cardiovascular outcomes of xanthine oxidase inhibitors with placebo reported in combination of randomized controlled trials and observational studies. When I say about xanthine oxidase inhibitors, I mean febuxostat and allopurinol. And when I talk about cardiovascular outcomes, I mean cardiovascular mortality, heart failure, myocardial infarction, and major adverse cardiovascular events known as MACE. So we followed the PRISMA guidelines to conduct this meta-analysis. We searched Ovid Medline, Ovid Embase, Web of Science, and Cochrane Central Registry of Randomized Controlled Trials to identify potentially relevant articles up until November 2023. Studies must be randomized or observational, reporting cardiovascular events and mortality outcomes in both xanthine oxidase inhibitors and placebo patients. And data was analyzed using RevMan version 5.4 software. Additionally, Microsoft Excel 2013 was used to assimilate the extracted data after EndNote version 20 was utilized to remove duplicate searches from screen publications. So amongst 3,397 studies retrieved from the search and 3,365 full-text studies reviewed, 30 different studies totaling of more than 300,000 patients were included for analysis. Out of 30 studies, only 9 studies were conducted exclusively on patients with gout, while the rest of studies comprised a combination of patients with or without gout. So pooled analysis results are summarized in the table 1. So you can see in the table, this is the table 1, you can see all-cause mortality, cardiovascular mortality, myocardial infarction, heart failure, and major adverse cardiovascular events, MACE. And this shows the number of studies. Total we have like 30 studies and number of patients as well. So each study had both xanthine oxidase inhibitors arm, which is a treatment arm, versus placebo, which is a control arm. And you can see in all cardiovascular mortalities and all cause mortality, there was like no significant association between xanthine oxidase inhibitors and placebo. Also, this is a figure 1 is showing the forest plots and also show the odd ratio for all cause mortality. This is a cardiovascular mortality, myocardial infarction, and heart failure. So you can see there's like no significant association between xanthine oxidase inhibitors and placebo. And this is the forest plot showing odd ratio for major adverse cardiovascular events, MACE. So you can also see there's like no significant association. So many studies have highlighted significant association between uric acid lowering medications such as xanthine oxidase inhibitors like allopurinol and febuxostat and cardiovascular outcomes. However, the effectiveness of uric acid lowering xanthine oxidase inhibitors remain uncertain. So as a result of this thorough meta-analysis, the evidence falls short of establishing a foundation for exclusive urate lowering intervention solely directed at reducing cardiovascular events. So, further research is required to determine the mechanisms for improving survival, which may be non-cardiovascular, and which subset of patients xanthine oxidase inhibitors may benefit. Thank you so much.